has kind of identified a real need for kind of working beyond our kind of regions together, and by kind of combining our pull and our networks, we'd be able to kind of hopefully draw in an audience which is really relevant to the products we're talking about, and yeah, giving a greater coverage really for what they do. In terms of the AHSNs themselves, really from my point of view, it's about spreading innovation across the NHS, working with companies to understand their solutions, working with the NHS to understand what their problems are, and marrying those two together, so we can kind of provide solutions that are really going to make a benefit and impact across the region. So today is about IEG4. IEG4, it's a continuing healthcare solution, which is a massive potential to impact across a broad area of the health system. So
unknown participant is now joining.
Oh, there's someone else joining there as well, but it gives you a really good idea, a rounded idea of what it can do and what potentially it can do for your area. So with that, I was going to hand across to Charles to give more information about what the product is, how it works, and what we'll be talking about together. So Charles, if you'd like to take control.
Thanks, John. I do like to take control, so that's fine. I'm now in control of the slides. What I want to do is just take 10 minutes to talk about the journey IEG4 has taken in developing the evidence base around the digital innovation and digital platform we've got for continuing healthcare. Now, I've been appointed this year as an NHS Innovation Accelerator Fellow, which is really the NHS selecting a number of innovations which they believe will, as it says here, improve people's lives by speeding up the adoption and spread of these high impact innovations. So I just want to talk to you briefly about what I mean by the high impact innovation and why the NHS Innovation Accelerator has chosen IEG4 and myself as an organisation and a product that's of real relevance today. So what we're talking about here is Digital CHC. So really in late 2017, the NHS put out the call to improve continuing healthcare, and the SIP programme was born at that time. So what we did as a small software business who'd got really in-depth experience in local government in developing digital services for citizens across a number of different business units within local government. If you've gone onto council's websites, you've probably used some of our software in digitally engaging with your council. So anyway, in 2017, we decided to bring that expertise into the NHS and applied for a funding grant through the NHS to develop a digital platform for continuing healthcare. At that point, it was about streamlining the workflows and making sure that we could deliver a paper-free process from the checklist in terms of the referral right the way through to decisions. And really the evidence that's built around the benefits from that have allowed us to become one of the products in the NHS Innovation Accelerator. So how did we go about doing that? Well, what we did really at the start was to build the product with the NHS, really understanding what their needs and requirement were, and really understanding from them what the evidence was to allow for adoption. And it was very clear that the evidence was coming out from the initial implementation around how digital could deliver the better outcomes, better experience for staff and for patients, and the better use of resources within continuing healthcare. So at that point, we really looked at saying we need to make sure that this evidence is robust, and we were supported by the AHSNs in the north, both in terms of undertaking independent evaluations and also ensuring that we were connected with the right people across the north as well. So what's happened from that initial cohort is a lot of evidence being developed, and through discussions we've now had adoption from Sunderland, and you'll hear from David Britton in a little minute about how he's undertaken that digital transformation process, and most recently with Dorset CCG as well have delivered their rollout of this. So what we've seen is there are many discussions also with numbers of different CHC services, and it's interesting to see where organisations are in their journey about are they ready, are they willing, or are they able to adopt a digital platform. What we do is encourage the system to just have a look at considering how digital could transform their service. Because what we've seen with the Cheshire environment, where they've rolled out and had a lot of scrutiny around the evidence, is that this has delivered award-winning digital continuing healthcare. And most recently, just with the HSJ, this last week was the finalists in the Health Tech Partnership Awards. So that's again is evaluation of the benefits that come out from digitally transforming it. And that assurance and the overview has really allowed us to say that there's really no other digital CHC product that has that level of evidence and assurance. So let's just look very briefly at some of that evidence, and we say that our product, CHC to DST, supports the service transformation in continuing healthcare. What we've seen coming out in terms of service transformation is there are some immediate benefits from digitisation. The area around less reworking, that is really enabling us to get the checklist right first time. The digital checklist is really a way of imposing the information that's required by the CCG, both in terms of the checklist and any associated documentation. The improved quality we've seen from really ensuring that referrers have visibility of what their quality is like of the checklist. And also we see the single point of entry, so every checklist, every referral has to be delivered through the web-based digital checklist. That single point of entry means that no cases are lost. There's no checklists in any other place. They're all in one point, and the fax machines can be switched off. And what we've also seen with improvements in efficiency is it gives staff more time to improve CHC. So we've seen a freeing up of both clinical admin time in the rollout of the digital solution. But also what we've seen is that digitisation really supports the national goals for CHC in terms of a more timely service, so it improves the ability to achieve the 28-day target. The workflows that are built into the digital system really make the process much more reliable in that the workflows deliver the national framework. So digitisation really then ensures that the national framework is delivered, and the consistency is also delivered through every patient following the same journey. So that again reduces the amount of unwarranted variation in the service, and every patient has a consistent view of doing that. And then finally, the transparency is there because everything is contained within one system. All the documentation is readily available and can be viewed as the process continues. And also this transparency allows for rapid update of new functionality, in that the SIP programme published their national consent form, I think a couple of weeks ago. That is now being rolled out as a live consent form that each of those areas that have our system will be able to roll out immediately. And then really finally is about supporting the NHS in its digital journey and the long-term plan around the digital agenda. NHSX now with their 5 missions around improving digital for the workforce and for patients. So our service is in the cloud. It's hosted as a compliant service to NHS standards, and we're involved with NHSX in consulting on the digital standards. Security is maintained and is assured through the Data Security and Protection Toolkit from NHS Digital, and it's protected in terms of security and the highest levels of security. And what we've seen is that the cloud hosting is also really valuable in delivering an interoperable solution. And where required, we're looking at kind of innovative ways to ensure interoperability with other systems, both in local government and in NHS, and really working around some of the blockers that exist with areas which are not willing to look at interoperability. So overall, the service has really come to the point now that we have a national case study around digital transformation, and that's shown quite clearly the ability to increase 28-day completion targets. The number of days that patients are waiting has seen a dramatic reduction, and really importantly, we've shown that 13 hours of time within the service can be freed up per referral. We've seen that being allocated to clearing backlogs, spending more time on care management. So that 13 hours of time freed up is really very critical in digital transformation. And then I think finally, although we've talked a lot about digital, it's all about the people. And Liverpool John Moores University has undertaken an independent qualitative evaluation around staff feedback. And I think you can see from some of the comments there that staff have found, once they've got used to the system, it really delivering great benefits for them. So now we're focused on 2020 at IEG4 and really delivering new functionality and continuing to develop the digital platform to cover the full breadth of the NHS England digital specification. Consent forms gone in just within 2 weeks. And now what we're going to do is to look at the latest innovation is a patient portal that Jackie has developed within IEG4, which actually delivers the NHS England patient portal requirements today. It will be rolled out with our existing customer base. So what I'd like to do is just let Jackie show you the patient portal, and you can see for yourself how you might be able to better engage with patients and their families.
Okay, thanks, Charles. Okay, good afternoon, everybody. Let me just share my screen, and we'll take you through the live demonstration now of the IEG4 patient portal. Just before we go into the portal itself, just to sort of back up what Charles was just describing there, when we were developing the patient portal, we obviously had access to the document here from NHS England, which had listed on it the essential functionality that a patient portal should include, and also a list of nice to have items as well. So I'm very pleased to tell you today that all of those items, both essential and the nice to have, are available in the patient portal product that we've been working on. So let me just move across now to my browser. And
Is now exiting.
hopefully now you should all see a sign-in screen. So this is a sign-in screen to the patient portal. And the way it would work with the organisation, this would be branded to look like the rest of the CCG's website. So there would be some sort of link that would be on your website that would say, please click here to access the CHC patient portal. And then either the patient or their relatives or advocates would be able to sign in from this point. Now, just by way of introduction, the patient portal that we have here is provided using a product called OneView. The OneView product has been in existence now for the past 4 or 5 years and is used across many local government sites. So as Charles mentioned in the introduction, many of you who might go onto your local authority's website and maybe want to access your council tax bill or report a missed bin collection, that sort of thing, you may well already be using the OneView product. So OneView is a citizen portal that can be used to access real-time information that's held in separate back office systems. So as part of our development, we've linked our OneView product to our digital CHC case management system. And what that will mean is that a patient could sign into OneView, and that will give them real-time information about the progress of their application for continuing healthcare funding. It also allows relatives or advocates to also do that on the patient's behalf, and we'll be covering all of that as we go through the demonstration. Now, in the beginning, when somebody wants to use a patient portal, they will need to create a OneView account. So you can see here we've got the sign-in screen, and we've also got, just on the right-hand side there, a number of options where someone can create an account using other platforms. So if they, for example, if they use Facebook or they use Google, they could create a OneView account with those credentials. So they're not having to remember separate passwords and so on. The option at the top that on this demonstration version says sign in with the Lewisham My account, that could actually say there sign in with the NHS login. And we're currently in the process of applying to have our product aligned with NHS login as well. So what I've done, I've created a OneView account using my email address. So I've got here my email address and my password. If I now sign in, this will take me into the OneView product itself, and we'll be presented with a number of tiles which will appear on the screen, and these can represent as many different service areas that the CCG would like to make available to the patient or their relatives. So on the Get Answers Fast page, this is where we've got the tiles located. We've got a couple of examples here which are showing me continuing healthcare information. I'm just going to scroll down a little. So some of these other tiles, just to make you aware, each of these can access different back office systems, and that's how it works with our local government customers currently. So I could be a citizen who wants to access my council tax account, I want to look at my benefit claim, I want to apply for a taxi licence. All of these areas can talk to separate back office systems, but as far as the citizen's concerned, it's a single sign-on. And that's the same approach we've taken for patients to access progress of their continuing healthcare application. So the tile here that says details of your application, if I were to click on that tile, it's now accessing real-time information held in the CHC case management system. And you can see here, it's showing me straight away the status of my CHC application. So it's telling me that the CCG started to process my application, and it's pulling through the date from case management, and the fact that my application is at the stage where the MDT meeting has actually been completed. And then just beneath that, if I then want to know what happens next, I simply click on a question, and that will expand to show the answer to that particular question. So it's advising me now as a patient, whatever the outcome of my assessment of eligibility for CHC, I'll receive a formal notification of the decision in writing. But the timeline just below is showing all the different stages.
Unknown participant is now exiting.
My case has been through so far. So the dates and the descriptions that you see here, they're showing the stages in the workflow process my case has been worked through. So I'm fully up to date. I know everything that's happened and also what's due to happen next. What I can also do through the patient portal is view any documents which are linked to my case as well. So you can see here that so far in my case there is the checklist that was submitted to the CCG. I've got the option there, if I want to download and then view that document, I can do so. So that could be any of the documentation that the CCG is generating as part of that CHC process. So at the moment, my case hasn't reached a decision, so there isn't a decision support tool for me to view, but that would be available as soon as that's been completed. So by giving patients the ability to view documents themselves, that might well save the CCG some time and money in having to produce paper documents, sending those out to patients or their representatives. So what we're looking at here within the answers to the questions is real-time information. So the first question at the top there is saying, what is the status of my application? So we've got some words which is advising me that the CCG started processing my application, but that date that we see, that's the real-time information being pulled back from that separate back office system. So although with our example here, we're accessing the IEG4 case management system, that in reality could be looking at any case management system that the CCG may use. And the whole idea is to be more transparent so the patient is able to check on the progress without having to make what we call avoidable contact. So that's basically reducing the burden on the workflow within the CCG, because they're not receiving inquiries that could be answered through the patient portal itself. Further down the screen, if I scroll down a little further, so we've got questions here which are pulling back that real-time data. So another example here, can I see details of when meetings to discuss my case will take place? That's pulling back the date of the MDT meeting and also the location, etc. But we've also got some questions which have what are called static answers within them. So an example here, what is NHS continuing healthcare? And then the response is explaining that it's a package of ongoing care that's arranged and funded solely by the NHS. And then as part of that answer, we're also presenting a link to a video. And this is actually an NHS England video that we've embedded in the response. We could also have more static questions, so how to apply for funding. So again, an explanation to the patient of who will be able to refer them for continuing healthcare, information regarding the decision support tool and the decision itself. So all of this sort of information is typically what NHS England are making available already. So we can reuse that information to make sure that's all kept fully up to date. We can also, as part of answers to questions, have links to other websites as well. So that could give me a link to view, for example, the framework for continuing healthcare, which is obviously maintained on the Gov.UK website. So you don't necessarily have to reinvent the wheel with the answers to the questions. We can signpost patients and their relatives to where that information is maintained and ultimately kept up to date. Now, in order to view the real-time case information, there is a second level of authentication required. So I mentioned in the beginning that patients or their relatives can create a OneView account by using Facebook, Google, NHS login or an email address. But to be able to view information on the case, they will need to provide relevant information. So for example, they'd need to provide their application reference number, the last name on the case, and also the NHS number. And then when they click on link account, that's when we talk to the case management system to check those three fields match against a case in the system. So what you would be able to do as part of promoting use of the patient portal is to provide this information to the patients or their relatives to encourage take-up and use of the patient portal. And this is very similar to the experiences we have with our local government clients, where they're wanting their council taxpayers to use OneView. It's all about promoting use of this and providing the information they need to access it. Now, mentioning about relatives being able to have access, a standard as part of OneView in the Your Profile section, there is an area where you can allow friends and family to access your account from theirs. So it could be a situation where, say, my father's going through the CHC process. He has his own OneView account because he pays council tax or whatever. He could grant me access to view the progress of his CHC account. And you can see here, we've got the ability to say who I'm happy to share my account with, and also details of friends and family who've said that they would share their account with me. So all of this functionality was built into our OneView product already. So to enable it to be a patient portal, we basically linked, using APIs, the OneView product to case management. And that meant we were able to meet all of the essential and nice to have functionality items that were listed by the NHS SIP programme for CHC. We have also presented this to the lived experience group as well. So we've done a couple of demonstrations now and have asked for their feedback, and they were all very positive. You know, these were all people who'd either been through the CHC application themselves or with a relative, and they just said, if only we could have had access to this information when we were going through that process. So we're basically just providing a tool to keep people informed. Just one thing to sort of finish off on, the content of the patient portal. So that's where we have the questions with the answers. These are all in control of the CCG. So at any time, the CCG can add more questions and give more answers. They can also change the order that the information appears in as well. So this could be continuously improving that patient experience. It's not just something that's set up and it has to stay as it is. This can be very much be something that changes over time. And again, the whole point of this really is to give people a tool to access information and services directly. So, you know, they can best take charge of their own health and social care, for example, but it's providing them with real-time information. So they're no longer being kept in the dark, that they're being empowered. They know exactly what's happening with their application. So just conscious of the time, that was a very quick overview of the IEG4 patient portal. Again, it's a tool that is very simple and easy to use, can be used by patients, relatives or their advocates to access information about the CHC application. What I'm now going to do is hand over the presentation now to David Britton, who's now going to talk about the experiences at Sunderland. Okay, David, if you want to now just share your desktop. Oh, hi, David. I'm just checking. Can you hear me okay? Are you able to share your desktop and just take yourself off mute, please?
Hi, Jack. I'm not sure what's happened to David.
No, David is still on the meeting.
Hi, it's John here. Did you want to move across to Matthew if David's having some technical issues?
So I'm just thinking, Matthew, if we want to move on to your presentation and see if David can catch up.
Yeah, that's absolutely fine. Can you hear me okay?
Yep.
Marvelous. I shall just share my screen.
Thank you, Matthew, for moving up the order.
Not a problem. Not a problem. Right. So I just made my screen full size, just checking you can see that okay? Okay.
Yeah, that's good.
Marvellous. Thank you, Charles. Right, hello everyone. My name is Matthew Watts. I'm from NHS England's CHC Strategic Improvement Programme. Charles has invited me along just to spend a bit of time talking about digitising continuing healthcare, the work we've undertaken as part of the Digital CHC project, and it's titled The Past, the Present and the Future. Now, there's two of us in the team. There's myself, Matthew Watt, and we've got Martin Ware on the line. Those are our pictures, our email addresses and phone numbers. You've probably come across one of us at some point in time. If not, you're more than welcome to get in touch at any point in time if you want to talk about digitising your service or anything else related to CHC. So I can tell you a bit about where we've come from, where we are now, and where we're going to go next. So let's look back. Well, the project, the Digital CHC project, started in May 2018. We are part of the CHC SIP programme. We started off by working with around 50 organisations, CCG, CSU, suppliers, NHS England, basically anybody that had an interest in digitising continuing healthcare. The intention was to try and develop a number of things to help organisations with their digital transformation. This involved a whole bunch of research, in essence, just asking you, what is it you want and need from a digital system? And then trying to describe this. Now, we use the CHC maturity matrix to do this. This is the football on the left-hand side. You've hopefully all come across this. And we then just lay this out and described each of those bits as a workflow. So you'll recognise this, maybe not in this format, but these are all the things that your service does. And what the Digital CHC project tried to do was take all these different bits, in essence, describe what happens digitally within the screening bit, within the assessment, within verification, within PHB, etc. So, where are we now? Well, we've co-created the Digital CHC Toolkit. Now, this is free to use, access, and do whatever you want with it, really. Now, there's 5 main things as part of this. There is a roadmap that describes the digital transformation journey. There are various tools that allow you to assess your systems, either very quickly, in roughly 15 minutes with a couple of statements, or do something a lot more detailed. And you may recall Charles mentioned before around looking at business needs and user needs. Well, what this document does, it describes the user needs or the business needs from a service perspective. So what does a CHC service need in terms of screening, in terms of the assessment, in terms of financial management, etc., market management? Now, there's also a document which is far more detailed, which you can use for procurement. And then there's a whole bunch of useful tools, looking in terms of strategic planning, how to develop good business cases, how do you undertake better digital procurement. This is all part of the Digital CHC Toolkit. Now, very quickly, this is the digital roadmap. This is very common. You'll recognise a lot of these steps from various change models, particularly the NHS change model. But most change projects follow a very similar type of format. You have to identify a need for change. You have to figure out what it is you're going to change, plan it, and then do it. And where the digital toolkit really fits in is this bit in the middle. What is it that you're going to change? So the various things that we've co-produced allow you to assess, what does your CHC service do now digitally? What would you like it to do? You can then use those exact same things to assess suppliers, see who's doing what in the market. You can use it to have conversations with other people to see what they've done and learn from it. And then you can develop your own specification that you can then take to the market to procure. Now, this is just a simple screenshot from one of the documents, but in essence, it describes the workflow. It's a process map. Now, this is all editable. Now, in order to digitize your service, you have to really describe what does your service look like. Now, this is a set of process maps. You can edit these, you can discuss with your team. If it's like this, you just leave it the same. But on the right-hand side, you get a summary of business or system requirements. In essence, everyone wants a system that can capture referrals, flag mandatory fields, capture signatures, etc. Users want to be able to complete, upload and submit referral documentation. So this really describes all the things that you would take to a supplier in order to say, right, we want a system to do this, and we want it to do it in this way, follow these sequence of steps. So this is all part of the Digital CHC Toolkit. I recommend you access that and have a look at it. But what's our key learning to date? Well, first of all, there's no one-size-fits-all approach here. Everyone is doing something completely different, but they're trying to do very similar things, but possibly in a slightly different way. Now, the toolkit's been developed in a very modular fashion. Now, you see the bit of a sort of strange thing on the right-hand side saying, what does your potato look like? And really what this is trying to express is that everyone's trying to deliver a CHC service, which is the potato. But actually how they go about doing it and configuring their service varies from organisation to organisation, either because of their workforce, their policies, their technology, all these different things. Now, what the Digital Toolkit tries to do is help to demystify digitization. It's not quite as scary and unknown as you may think. It takes all that technical stuff and puts it into something that you can work through with your team. You can then have better conversations with suppliers. And the key point about this is about people first, not technology. So, where are we going next? Well, first of all, there's three really interesting policy developments I just want to make you aware of. The first is the Matt Hancock, the Future of Healthcare, the Tech Vision. Now, this came out in December 2018, so it's about just over a year and a bit old. If you haven't read it, I recommend it. I've also summarised it as two-page summaries. If you want that, get in touch. But it's very interesting. It talks around how do you innovate within the technical environment. It talks about the infrastructure that people use around open standards and trying to encourage local choice. So this is less around massive national procurements and more around how do you procure what you want locally. Now, we all know about the long-term plan. This is a summary of the various bits and bobs. It talks around the digitisation of primary care, electronic patient records. There's some very interesting stuff around the use of artificial intelligence and decision support. It goes into a lot of stuff around patient data. Now, you'll be aware, hopefully, of the patient-level data set that our team are producing. So this aligns with that. Various things on technical standards. And for the first time, it talks around how can we develop an ecosystem that is supportive for the industry. So how do we support developers and innovators to actually do things, for example, like Charles and IEG4 are doing? How can we better support organisations like these within the technical environment to deliver services? And finally, NHSX, on the left-hand side, you see a whole bunch of stuff. Now, they're around setting policy, they're around reform procurement, workforce, etc. Interoperability is a word that you'll see more and more often. It basically means how do you connect one business system to another system and make sure that they connect seamlessly. On the right-hand side, you can see what some of their aims are. They're trying to reduce the burden on the workforce. They're trying to give people tools. They're trying to give information so that which can be safely accessed when and how it's needed. They want to improve the safety of this access of information and safety of the use of that data, but also ensure that people have the right tools that can improve how they go about their business to make it more efficient, more productive. Now, what are we doing for the next year? Now, you'll be aware, hopefully, that this next year coming up, the next financial year, is the final year of the Strategic Improvement Programme. It's also the final year of the Digital CHC project. Now, what we're looking to do is culminate all of our learning, provide as much support as possible, get as much stuff out. Now, we've done a couple of things. We are funding some pioneers. Now, the pioneers are organisations that apply for a bit of a grant. They're all doing something innovative, something different. Now, the first wave, which we advertised this last year, is around digital transformation. So these are all organisations doing something unique. You have Dorset looking at robotic process automation. So how do you automate tasks? You have Sheffield who are developing their own centre of excellence. You have Cheshire looking at the patient portal and the standards that are needed to integrate with other systems. So that's the digital pioneers. Now, what we're hoping to get out of this is a whole bunch of learning, some case studies, take all the documentation, some methodologies. So actually, if you want to go down and follow the robotic process automation route, which is basically a fancy Excel macro, you can see how someone else has done this. You can follow some of the things that they've done and learned. They're also funding CHC Transformation Pioneers. This is the same principle as the Digital Pioneers, but it's much broader. So we put out an advert at the moment, and the applications for funding close on the 20th of March. So if you're not aware of that, do get in touch. But in essence, we're giving funding to organisations who are doing something pioneering across health and social care organisations, who are transforming their service, doing something new that we can learn from and share across everyone else. Now, we're also updating the Digital CHC Toolkit. Charles mentioned the patient portal, Jackie gave a demonstration. So we'll be describing what are the things that you need for patient portal. There'll be some stuff on the patient level data set. So what are the different data fields that are needed within that, or the timescales, etc. Now, we're planning on hosting the first Digital CHC conference. Now, the dates, we roughly October, the content is all to be discussed, but this will be the first time that we're coming together on a national basis to bring people together to talk digital. How do you transform your services? We're also running a digital academy, the CHC Academy. This is a set of virtual learning. So the idea will be over 9 months, there will be one session a month, approximately 1 hour, all virtual. And it's an opportunity to get to grips with digital transformation. Run through the digital toolkit, the roadmap. It's a chance for you to ask questions. How do I go about doing this? What do I need to do that? So it's a completely free opportunity. We're also working with commissioners on a national basis across health and social care, offering direct support. If you want to digitise your service, you don't know what to do, feel free to come to speak to us. We can even work with you directly through our SIP regional leads and the new ADAS regional leads. So any support you want, do get in touch with myself and Martin. And also the Health System Support Framework. If you're not aware of this, this is an NHS England procurement framework. Now, the idea is you can go on, you can take the digital specification, which is part of the toolkit, and you can basically go on, put that on there, and organisations will be able to come back and say, right, we can provide this service. So it's like a lot of other procurement frameworks. However, there is a specific lot for CHC. Now, we're currently going through the process of scoring bidders. Now, this framework will be live in early April. But the idea is it should greatly speed up the procurement of digital services. So these are the activities that are going to come up in the next financial year. Martin, is there anything else you would like to add? We shall just give Martin a moment to get himself off mute. So, whilst Martin's doing it, if you want any more information about the digital toolkit, any of the support we can provide, the conference, we also send around a newsletter on sometimes a regular, sometimes a less regular basis, basically when there's something to say around the digital work. So get in touch with me. My email address is there. I'll add you onto that. And that's where you can also find out about the various standards. Now, a couple of things to note. NHSX have just appointed a new Chief Information Officer, Sonia Patel. So that's something worthwhile keeping your eyes open for. And they've also just published a new technology standards framework. So I'll be circulating more news on that in the next couple of days. Right, that is me done. If anyone has any questions, I'll just check that David is on the line first. David, am I able to hand it over to you?
I'm here. Can you hear me all right?
I'm just going to stop my screen sharing. And David, over to yourself.
Okay. Thank you, Matt. Can everybody see the screen all right? Yep. Can people hear me?
We can hear you, David, but we can't see your screen just yet.
Okay, just give us 2 seconds.
There's a small rectangle with an upwards arrow that you need to push.
Yeah, I've got it. Yeah, I'll click that. And it is not, let's have a look. That one.
David, would you want me to show your slides and you can talk to them?
There you go.
Got it.
No, have you got the slides there now?
Yep, you're all good.
Yep, okay, fine. Hello, everybody. As the slide says, my name's David Britton. I'm Commissioning Manager at Sunderland Clinical Commissioning Group. And basically, I'm here really to go through our little journey on digitising CHC. And it's been a bit of a journey, even a short period of time. We actually started the journey in 2018 on the back of the fact that the CCG recognised that the CCGs, like with everybody else, the CAC spend was on the increase and we need to do something about it. So I think there was a report that came out by Deloitte that we had a look at, and it identified that the best performing CCGs were those ones that had full control of the CHC process. But at the time, all the process we had contracted out. So, for example, the assessment function was delivered by the local FT, and the commissioning, contracting, brokerage, and invoicing, and that sort of thing was done by the local authority. So really, we had no specific eyes on what was going on. So we knew we had to do something about it. So, cut a long story short, from a technical point of view, we had 3 spreadsheets. They were absolutely wonderful spreadsheets. One held by the local authority, one held by the CCG, and one held by the assessment team. And neither 3 of them were talking to each other properly for obvious reasons. So we knew we had to take control of the process at some point. So the idea was that we were going to take full control, starting off with being the assessment team into the CCG, which we did. But on the back of that, we were looking at then how we were going to try and move towards having the brokerage and contracting done. But we were going to worry about that later on as part of the transformation plan. So really, that's the background. That's where we came from. I'm talking more about the digital transformation and working with staff. The barriers we found when we went through it, it was all right for me because I'm technically okay from looking at systems. But we were dealing with an assessment team that functioned really on paper and had no idea about digitization or anything like that. So it wasn't a case that we were on hiding to nothing. It was more about we were starting from rock bottom from a digital point of view, even to the point that when we moved the nurses onto laptops rather than desktop, one nurse turned around to me and said, "Somebody's taken the computer." And I said, "Well, your computer is the laptop that's in front of you." So I thought this is where we're starting from. So, you know, November 2018 is when we went live with the assessment platform. And I must admit, I was dreading it because I thought we're going to struggle here big style. And I had to put a lot of work in. It took me about 6 months to get everything prepped, ready for the change. But give the nurses their due. They embraced it. They took it on. As I say, from underestimating their digital technical ability, they underestimated their own technical ability as well. Because I kept saying to them, "Do they move? Do you book your holiday online? Do you do your online banking?" "Yes, we do. Yes, we do." "Well, this is no different, right? Okay, it's just that we're moving you from paper to a digital platform that you can do CHC with." So, and the other thing was it was this sort of losing touch of paper. And the other barrier as well, and my background, part of my background is I was a practice manager in general practice when they introduced digital systems then. And we had exactly the same problem with the GPs as I had with the nurses, is that they didn't like using technology while meeting patients, which is understandable, okay, because they see that as a barrier. But like with the GPs, the nurses have got used to that now, and they're making that. And right at the beginning, they were resistant to the change as well. So we were hitting barriers all the time, just with the nursing team within the assessment team. I must say, though, I must take my hat off to the admin side of the team because they seem to embrace it quite quickly and were supportive of the nurses and making sure that everybody wanted to get where they wanted to be. Where are we now? Well, what we did was we allowed the nurses.
Participant is now joining.
We allowed the nurses to work at their own pace. So although we've got 10 nurses within the team, they were all working at different paces, and we had to allow that to happen. So, you know, in the end, I think it took the last one up to month 3 to really get used to the digital things. We listened to their concerns and allayed any fears and worked with them quite closely. But the key thing was we came up with solutions quickly as well. So they weren't sort of, "Oh, it's not working, how do we get around this?" And I must admit, for about 6 months, I was being run ragged, but part of that desire was to make sure that everybody was okay. The team has worked well to develop the process and now works well with a plan. And now we've got nobody left behind. But what I will say is, as part of this process, is that whilst we focused on the team, making sure that they have got used to working with a digital platform, we mustn't forget the referrers. And I found that the issue, more of an issue with the referrers than I did with the digital team, or sorry, with the CHC team, because they were working with something that they've never worked before. Yes, they might work in a hospital working with their own system, but to give them something different, especially when they're referring the checklist in and using it through a different vehicle, if you like, was totally alien to them, even to the point even where the nurses didn't even know their own email accounts. So I was quite, for all that Matt Hancock goes on about digital and tech and all this sort of thing, realistically, it's quite alarming that I found that there's a lot of staff out there that aren't IT aware. They're very good at caring for the patients and they're very good at using the equipment that looks after the patient. But I think we're generally underestimating how little IT they know. And that was the biggest barrier for me. But we've worked through that and now we're up and running and we've got everything running and functioning properly. But I would say to anybody who's going through a process, you need dedicated time, definitely. We underestimated how much time and effort it would take to put it in place. But we are there, we're getting there, and now we're even to the point now where we've scanned all our records, so we have got no paper record at all. It's all digital virtually. We're just finishing off the last 3-month reviews now. Once they're done, they'll be scanned, uploaded onto the patient record. So now the nurses are quite comfortable taking their laptops out and they have access to everything they need through either the website or VPN or secure VPN. So they have everything at their fingertips. They don't have to run. And now, then we're now even talking about agile working and not necessarily coming back to the office. That's cutting down a lot of costs around motor mileage and things like that. And they're enjoying the freedom of being able to manage their own time, their own diary, and getting on with their things. So far, big tick, we're surviving and we're getting on with it. Thanks very much.
Thanks, David. That's always good to get the realist's view of digital transformation, and I'm sure you're absolutely happy for other systems that are looking to digital transformation to get in touch with you to understand how you brought the team with you and the process within the kind of multiple stakeholders you've got.
Definitely.
And thanks for keeping to time. So really what we're going to do is just, I think, finish off the webinar. I think John's just going to say some closing comments. And if people have further questions, we'll just leave up at the end the contact details for either myself or David or Matt to be able to contact us directly.
Hi, thanks for that, Charles. Just wait for you to get through to that. Yeah, the last slide we've got there. So yeah, just wanted to draw the session today to a close. Kept very good time there. Very pleased with our punctuality. So yeah, I just wanted to say, hope these presentations have sparked some thoughts and ideas and possibilities, and you can hopefully kind of go away and think about how potentially you can apply these solutions in the future. Just wanted to kind of thank all of our speakers as well today. It's much appreciated for them giving time to support what we're doing and the companies we're working with. Please feel free to follow up directly with them on any kind of questions. We've got the contact details on the screen at the moment, but we'll circulate these slides and a link to the recording shortly, so you can kind of revisit what we've done and look at what we're talking about as well. But yeah, finally, just thank you very much for attending the session today. It's the first of our Digital North Accelerator programs kind of sessions. We've got a few more coming over the next next few weeks, which again you may be interested to attending. But yes, thank you very much for today, and I hope you have a pleasant afternoon. Thank you.
Multiple people are now exiting. Multiple people are now exiting.
Steve
Is now exiting.